Hello everyone, I'm gonna talk about the greatest person in my life, my joy and happiness. He is called GB, who has the most charming opera voice in Spain. And I'm proud to be Miss GB. But unfortunately, a couple of months ago, he suffered from shortness of breath. While he was performing on the stage, it increased during his daily life. For this reason, he visited a physician with his medical history of diabetes type 2 for 6 years and he is on glyphosate 10 milligram.
Okay, JB, your lab test shows proteinuria and elevated cholesterol, and your diagnosis is stage 2 hypertension. So, the physician recommended two-drug therapy regimen consisting of hydrochlorothiazide 25 mg daily with another antihypertensive drug, but he wasn't sure what to choose between the three classes: angiotensin converting enzymes inhibitors, angiotensin receptor blockers, or calcium channel blockers. That's why he asked the pharmacist's opinion.
The first drug is losartan. It acts by blocking the action of angiotensin II at receptor site. It is used in hypertension.
The second drug is enalapril. It's an angiotensin converting enzyme inhibitor that's used to treat hypertension.
The third drug is nifedipine. It's classified as calcium channel blocker, dihydropyridine derivative. It's mainly used for hypertension and angina.
Enalapril. The structure-activity relationship shows that it contains secondary amine carboxylic acid phenyl ethyl that mimic ACE substrate. So, they are the basic structure of all ACE inhibitors. The role of ester group is to increase the oral bioavailability. So, it's formulated as a prodrug because inside the body it acts as enalaprillate. The two carboxylate groups that are ionized in glycinate part, which will potentiate the basicity of the nitrogen, leading to formation of Zwitter ion, results in poor bioavailability of enalaprillate. For this reason, in enalapril, the carboxylic group is masked by ethyl ester to prevent Zwitter ion formation, to overcome the poor bioavailability. So, it will enhance the patient compliance as it's taken once daily dose. The nitrogen ring must contain carboxylic acid to mimic the C-terminal carboxylate of all ACE. The carboxylate group has the ability to chelate with zinc. Also, it acts as a tetrahedral carbon which has a labile peptide bond. So, it has the ability to mimic the transition state. Methyl group that mimic the side chain of alanine that increase the affinity to ACE. The hydrogen bond between ACE and carbonyl group of enalapril increase the affinity. The secondary amine plays a role in the drug's inhibitory effect by hydrogen binding with the enzyme. Its removal will decrease the overall drug's activity.
Losartan. The structure-activity relationship shows that it has a acidic group which is called phenyltetrazole. It is essential for the activity because it mimics the ether phenol of tyrosine 4 of angiotensin II receptor. In addition, the tetrazole ring is metabolically stable and more lipophilic, which makes losartan has a high oral bioavailability and provides an enhancement of binding to the receptor due to the greater charge distribution of nitrogen atom. The N-butyl group provides a hydrophobic binding with isoleucine side chain of angiotensin II receptor. The imidazole ring mimics the histidine side chain of angiotensin II receptor. The hydroxymethyl group mimics the phenylalanine 8 of angiotensin II receptor through either ion dipole or dipole-dipole bond. The phenyl ring is involved in the general base structure of angiotensin receptor blockers.
The structure-activity relationship of nifedipine shows that it has 1,4-dihydropyridine ring, which is essential for the activity. The nitrogen atom of pyridine ring is weakly basic due to participation of its lone pair in the ring conjugation. So, it's not ionized at physiological pH, and it must be not substituted to avoid the decreasing of the activity. The two esters group at carbon 3 and carbon 5 positions are optimizing the activity due to the electron withdrawing effect, and it had a role in increasing the lipophilicity of the drug to make it orally. The esters group of carbon 3 and carbon 5 are identical, and upon the crystal analysis, it shows that the carbonyl of carbon 3 is syn-planar to carbon 2 carbon 3 double bond, and the carbonyl of carbon 5 is anti-periplanar to carbon 5 carbon 6 double bond. The methyl groups of carbon 2 and carbon 6 are enhancing the activity. The phenyl ring at carbon 4 is perpendicular to 1,4-dihydropyridine ring and is essential for the activity. The nitro group substitution at ortho position is important for the size, positioning, and increasing the activity, which plays a role in making the phenyl group perpendicular to the 1,4-dihydropyridine ring to make the nifedipine structure able to fit in the calcium channel receptor and block the other conformations. So, the nitro group must be at ortho or meta position to possess the optimal activity.
According to the following, the pharmacist discussion is:
The drug of choice is enalapril because it lowers the hypertension and decreases the proteinuria. In addition, it prevents diabetic nephropathy due to its renoprotective effect. Also, it may prevent shortness of breath, which could be a sign of heart failure. And according to the structure-activity relationship, it will enhance the compliance of the patient with longer duration of action, as its prodrug form. On the other hand, we can use losartan as alternative of enalapril if JB shows any allergic reaction with enalapril, such as cough, which may affect his singing career due to enalapril mechanism of action of bradykinin, leading to allergic symptoms.
Nifedipine is not the drug of choice because it increases the proteinuria by its vasodilation effect in afferent glomerular artery, so it's less advantageous to use it in diabetic and renal diseases patients, which make it not suitable for JB's case.
At the end, we wish you both a well-being life.